Hello viewers, today we will be discussing about treatment options for premature ejaculation. When I made that premature ejaculation video about the causes of premature ejaculation, many people asked me to do videos on premature ejaculation treatment. See, premature ejaculation itself is a complex subject. We can't just treat it by giving some medications. We have to try some medications. If they are not working, then we have to change the medications. Now, the treatment of premature ejaculation, again it depends on the cause. Like the main video where we discussed about the possible causes like psychological, hormonal, then prostatitis, infection in the prostate, penile issues. So now in this video we will be discussing in brief about those treatment options. If it is psychological or anxiety related premature ejaculation, then we have some drugs like fluoxetine, paroxetine and epoxetine. Fluoxetine and paroxetine can be taken on daily doses, and sometimes even clomipramine can be taken on daily doses. But depoxetine is not for daily usage. We give it for only we give it as an on-demand drug. Only on the day of intercourse you have to take depoxetine. Very rarely, when nothing is working, then we will try depoxetine for a month on daily doses. But generally we start with fluoxetine or paroxetine. See, these two drugs are anti-anxiety drugs. Generally these are prescribed by psychiatrists also, but if you give them in very low dose, there are absolutely very minimal side effects. But same drugs, if you give in high doses, then you might feel drowsy or sleepiness is there. Then these are the possible side effects with these medications. Apart from that, there are no major side effects. But for some people, what happens is, these medications, when we give at lower doses, these medications may not work. Then we have to increase the dosage. But once you increase the dosage, then all the side effects will come into picture. So to reduce the side effect of these drugs, then we have to put these drugs under low doses. But how to help the premature ejaculation? There, the role of nutraceuticals will come into picture. There are some medications, we call them as nutraceuticals. They help in improving the function of these drugs. So suppose fluoxetine, if you are to give for, generally we start with 20 milligrams, but sometimes 20 milligrams may not help. Then we have to either give 40 milligrams or 60 milligrams. Instead of increasing the dosage of fluoxetine, and instead of getting side effects, what you can do is you can add these nutraceuticals to this fluoxetine 20 milligrams, so that there are no side effects, but if you are getting a better outcome and better control over premature ejaculation. So coming to drugs, we have only few drugs. Then what else you have to do? If there is prostatitis, you have to treat prostatitis, you have to take medications, antibiotics for prostatitis. We do semen culture. Based on the semen culture, we will find out whether it is a bacterial infection or not. Sometimes it can be viral infection, sometimes it can be fungal infection. Based on the infection, you have to treat the infection. Then, so what if there is chronic, there is infection in the prostate, and what if it is chronic prostatitis or bilateral seminal vasculitis? That is where the role of shockwave therapy comes into the picture. Because chronic prostatitis is always difficult to treat, sometimes you can't cure this problem. There, when patient is not responding with basic medications or basic antibiotics, then we can do shockwave therapy to the prostate, low intensity shockwave therapy to the prostate. That will bring down the infection. That may not totally cure the infection, but the infection level comes under control level. There again, after shockwave therapy, if you take same drugs which were not working for you, then you will see better control of premature ejaculation. Then what if both medical treatment and shockwave therapy fails? What has to be done? Then the surgery comes into picture. Then there is a surgery called microsurgical selective dorsal neurectomy. This is also called as switch technique. It's a surgery which is done to the penis. It's a small, it's a small daycare procedure. You might have to stay in hospital for a couple of hours and then you can walk back. It's a small surgery done to the penis to desensitize the nerves which are supplying your tip of the penis, so that there is partial numbness, and this helps in premature ejaculation. In at least 80 to 90% of patients, this helps in getting rid of premature ejaculation. So viewers, if you have any more doubts regarding premature ejaculation treatment, or if I miss any other point, try to post it in comment section. We will try to make videos on that particular topic.